radius and another is ulna. Okay, and the ulna is medially placed and radius is laterally placed. Again, it can be called as pre-axial bone and this is the post-axial bone. Suppose this is the axis and this bone remains in front of the axis. It remains in front of the axis. So it is pre-axial bone. What is the axis? Axis is an imaginary line of the body. In the upper limb, there is a rotation to the lateral side. In embryonic stage, there is a rotation of the limbs. Rotation of the limbs. In upper limb, the rotation is on the lateral side. So, thumb looks or placed laterally. Now, this radius is a long bone. So, it should have two ends, that is upper end and lower end, and the intervening shaft. If you can describe a long bone in this manner, when your examiner will ask, you will get a good, the examiner will have a very good impression, the upper end, lower end and shaft, and he will or he or she will give you a potential marks accordingly. Okay. Now in the upper end, we can see a disc-like structure. This is called the head. And it is rounded and broader on medially. Okay, it is a peripheral rim which is broader medially. Okay, this is the head as a whole. You can see the peripheral margin which is broader on the medial side. Okay, and following head we will get the neck. The constriction is the neck. So head, then is the neck, and also we can get a bony elevation on the medial side. This bony elevation is called radial tuberosity. Radial tuberosity. And this radial tuberosity we can find if you have radius, don't have any radius, then we can find it is smooth laterally, anterolaterally this is smooth, and posteromedially this is rough. Okay. And this rough area of this radial tuberosity, দেখো এখানটা rough, the whole is radial tuberosity, the posterior part medially rough, anteriorly দেখো smooth, the rough smooth, rough তো দেখি হয়ে যাচ্ছে, rough আর smooth, এই যে এটা স্মুথ আর এটা রাফ, এটা দেখেই হয়ে গেছে, দেখো এটা দেখেছো, এটা রাফ এটা স্মুথ, দেখেছো রাফ স্মুথ, তাই না? দেখো এখানে রাফ আর এটা স্মুথ না, এটা রেডিয়াল টিউবারসিটি রাফ সাইড, এটা হচ্ছে স্মুথ, আর দেখো হেডটা দেখো মিডিয়ালি, এটা মিডিয়াল সাইড, মিডিয়ালি একটু ব্রড, এই রেডিয়াল হেডটা, এই যে এই যে এটাতে একটা ডিস্ক লাইক এরিয়া, তারপরে হচ্ছে একটা পেরিফেরাল মার্জিন আছে, সেই মার্জিনটা দেখো ব্রড এখানটা মিডিয়ালি, রেডিয়াল টিউবারসিটি দেখো রাফ আর এটা স্মুথ না, তাহলে medially or posterior medially is rough and anterior part is smooth, দেখেছো? Can you rough part and smooth part, this is smooth, anterior part is smooth, posterior part is rough. So the posterior part, the rough part is for the insertion of one tendon. It is the tendon of the biceps muscle. Biceps muscle is an arm, in the anterior part of the arm we get this muscle, this is the biceps, and this muscle has got two heads or seps. Seps means head, two heads, long head and short head. They are taking origin from the, we know there is scapula, supraglenoid, tubercle or tuberosity, this for the long head, and short head is from the tip of the coracoid process of the scapula. So these two head unites at the middle of the arm, and ultimately the muscle becomes tendinous, and that tendon we can feel the tendon. If we taut the muscle, then we can feel the tendon, and that tendon is inserted over the rough area of the radial tuberosity, and in the anterior part, right, ঠিক আছে, মিলছে তো, মিলছে, in the anterior part we can get a smooth area. This smooth area is for a bursa. What is bursa? Bursa is a membrane bound area, membrane bound, synovial membrane bound, one cyst like structure. It is a membrane bound, a cyst like structure. This is called bursa, and these bursa are present মানে in many places where there is a chance of wear and tear, nature has provided small pillow-like structures. Pillow. So nature has placed a pillow-like structure over the smooth area. Why? The tendon, there is a tendency of the tendon may glide over the bone. If there is no bursa, then there will be a wear and tear of the tendon. Tendon may tear. So nature has provided one bursa. You have seen there are so many bursa in relation to the scapula. Bursa around the shoulder joint. There are bursa. That means membrane bound cyst-like structure which are called the bursa. So this is the radial tuberosity. Smooth part is for the bursa, over which the tendon of the biceps brachii. The examiner will ask, biceps? You will say yes. Bicep femoris? Yes, sir. No, sir. No. Bicep femoris? Yes, sir. Bicep femoris. Biceps. I don't have any idea, sir. Biceps. I know only the biceps. There are two biceps in the body. One is biceps brachii. Brachium means in the arm. And there is one hamstring muscle that has also got two heads of origin. Okay, on the back of the thigh. That is called biceps femoris. Okay, so that is the biceps brachii. Clear? Now, this head, over the head, ulnar. We can see there is an articulation between radius and ulna. There is superior articulation and inferior articulation. The articulation between the head of the radius with the radial notch of the ulna. So there is continuous movement. This movement is seen during pronation and supination. Okay, so this area is for articulation with the radial notch of the ulna to form the superior radioulnar joint. Okay. Similarly, there is a articulation, a joint formation between this area in the lower end of the radius, and this is the head of the ulna. The head of the ulna actually articulates with this area. This is called ulnar notch in the lower end of the radius. Okay. So this is the articulation between the head and the radial notch of the ulna, and there should be one binder, one ligament. Actually, it is taking origin from here, from the anterior part of the radial notch of the ulna. It surrounds the head. It surrounds the head and it goes to the back of the posterior border of the radial notch of the ulna. So this is like this, one ligament which ties the superior radioulnar joint that rounds the head of the radius, and the name of the ligament is annular ligament. Annular ligament. It is a very tough ligament. Okay. And it not only surrounds on the head, also the neck, part of the neck. Okay. So it cannot during pronation and supination, or suppose somebody is pulling, ওর হাত ধরে আমি টানলাম, ও রেজিস্ট করলো, there is no dislocation of the head because of the fact that ligament is acting. Okay. But in case of a child below 6 years of age, okay, the ligament is, the diameter of the ligament, okay, is diameter of the ligament which surrounds the head. It surrounds the head only, but it fails to surround the neck. Actually, it is developing, no? So there is a chance of slipping of the head, and it will go below, and there will be a dislocation. The circumference is less. The radius, the circumference of the radius is less than the ligament, so it can spill. It can slip. Okay. Circumference of the head is less than the ligament, and also that ligament is not properly developed at that age, so it may slip. That dislocation is called pulled elbow. Pulled elbow. It slips. If there is a pull, then this area will slip and it will dislocated below, because the circumference is small. Okay. And circumference of the radial head is small than the annular ligament, so it can, that there is a chance of dislocation. বুঝেছো? ধরো, হ্যাঁ, এক্স্যাক্টলি, এখানে ঘিরে রয়েছে, তুমি আবার টুক করে এর মধ্যে ঢুকিয়ে দিতে পারো। আমি দেখতে পাচ্ছি না, দেখার চেষ্টা করছি, কল্পনা করছি, তৈরির সময় চলে গেছে, গলে গেছে। From origin and insertion is from the ulnar, anterior part of the radial notch to the posterior part of the radial notch. Now we can come to the shaft. Shaft has got one anterior border. We can see one anterior border. Okay. This anterior border is coming down from the radial tuberosity, and it goes down. Okay. Like this. It's continued just above the, this is called the styloid process. You can see the pointer is there. This is called styloid process. Just towards the styloid process of the, just above the styloid process of the radius. So this is the anterior border. It is oblique in upper part. Chalk nahi na, অসুবিধা হচ্ছে। Okay. Is coming down from here. এরও আবার খাবার শেষ হয়ে গেছে, খাবার নেই এটাতে, খিদে পেয়েছে এর। So this is the anterior border. ঠিক আছে? The anterior border. Similarly, there should be a posterior border. It is also coming out from the radial tuberosity. Okay, like this. This is the posterior border, and it is continued up to this area. In the lower part, of the radius, on its posterior aspect, we get some bony elevations, and one bony elevation is very prominent, which is called tubercle, and this is called Lister's tubercle. So this posterior border is taking, we can trace it from the posterior part of the radial tuberosity, and obliquely it goes down, and it is continued up to the dorsal tubercle of the Lister. This is called dorsal tubercle of the Lister, Lister. So this is the posterior border, and there is an intermediate border, very sharp. It is also taking that we can trace it from the radial tuberosity, and it will go down. Okay, it will go down, and it is continued. In the lower part, we can get a triangular area. Okay, we can get a triangular area in the lower part on its medial aspect. This triangular area, this is the base, this is the apex. This is the posterior part of the triangle. So this border is continued up to the posterior border of the triangle. So this is called medial border or the interosseous border. Okay, because interosseous membrane actually gets attached. ওটা কোথায় দেখো? What is interosseous membrane? A membrane which binds the radius and the ulna. In between the radius and ulna, there is a membrane which is called interosseous membrane. So this interosseous border of radius and interosseous border of the ulna, they are for the attachment of interosseous membrane. Okay, this is radial tuberosity. Similarly, there is an ulnar tuberosity. Okay, from ulnar tuberosity to radial tuberosity, there is another binder which is called the oblique cord, that is a ligament. One ligament connects this ulnar tuberosity and the radial tuberosity obliquely, which is called oblique cord. Which is called oblique cord. In between this oblique cord and the interosseous membrane, there is a gap. This interosseous membrane is continued, suppose up to this. An oblique cord is there, and in between the oblique cord and the interosseous membrane, there is a gap. কল্পনা করতে পারছো? This is radial tuberosity, this is ulnar tuberosity. So one ligament is continued from here, from ulnar tuberosity to radial tuberosity obliquely. That is called oblique cord. And here we are getting the interosseous membrane. So interosseous membrane ends, suppose here, and oblique cord is here, and in between interosseous membrane and the oblique cord there is a gap. Can you imagine? In between there is an interosseous membrane, radius and ulna. In between there is a membrane which is called interosseous membrane, and there is one oblique ligament, oblique cord. So in between this oblique ligament and this is the end of the, suppose, interosseous membrane, there is a small gap, oblique cord, and this is membrane. This is the upper end of the membrane. So there is a gap. Okay, like this we can get a gap between oblique gap and interosseous membrane. বুঝতে পারছো? This is the ulnar tuberosity and this is radial tuberosity. Oblique cord এরকম ভাবে আছে আর এখান থেকে শুরু হয়েছে interosseous membrane. তাহলে in between there is a gap between the oblique cord and the part of upper end of the interosseous membrane, there is a gap, and through this gap one artery goes from the anterior part of the forearm to the posterior part of the forearm. That artery is called posterior interosseous artery. And there is one common interosseous artery which divides into two branches. One is anterior interosseous and one is posterior interosseous. Anterior and interosseous artery goes down over the interosseous membrane, and the posterior interosseous artery passes through this gap and it goes down over the posterior part of the interosseous membrane. So common interosseous artery, there is one artery which is named as common interosseous artery, which has got anterior and posterior branches. Anterior branch is placed over the anterior part of the interosseous membrane, and the posterior passes through that gap and it is placed over the posterior part of the interosseous membrane. That means anterior interosseous artery, posterior interosseous artery. Similarly, there is one anterior interosseous nerve and there is posterior interosseous nerve. The anterior interosseous nerve is a branch of median nerve and posterior interosseous nerve is a branch of radial nerve. Sir, I cannot remember so much. যদি মনে রাখতে না পারো এখন মুছে ফেলো, পরে আবার এই পার্টটা মুছে ফেলো যদি মাথায় নিতে না পারো। ওকে, পরে আবার বোঝা যাবে। Just remember, there is one anterior interosseous artery, one posterior interosseous artery, one anterior interosseous nerve, one posterior interosseous nerve. And the remember one thing, the posterior interosseous nerve is very important for your examination. In many times, short note comes on posterior interosseous nerve. Okay, forget it. Now, so we have come across the borders. Similarly, we can get anterior surface. Similarly, we will get the posterior surface. Similarly, we will get on the outer side, that is a lateral surface. So radius has got anterior surface, the shaft has got anterior surface, posterior surface and the lateral surface. and they are bounded accordingly, like anterior surface is in between anterior and the interosseous border, posterior between the posterior border and interosseous border, and lateral is between anterior and posterior borders. Okay. From the anterior surface, you can, and over the anterior surface, we can feel a groove. দেখো এখানে groove feel করছো, দেখো এই ওপরটাতে। We can feel a groove in anterior surface and more on the upper 3/4 of the anterior surface. You can feel a groove. Upper 3/4 of the surface, we can feel a groove. Groove means depression, and groove means depression. দেখো না, বুঝেছো? This groove is for origin of one very important muscle. There are some superficial flexure muscle and some deep flexure muscle. One is superficially placed and one is deeply placed. And this is bone. So over the bone we will get the deep seated muscle, and that muscle, actually the action of that muscle is flexion of the thumb or pollex. So name of the muscle should be flexor pollicis. Pollex, pollicis longus. It's a long muscle, and this flexor pollicis longer muscle is taking origin from the upper 3/4 of the anterior surface of the radius or body of the radius. Okay, that the muscle is called flexor pollicis longus. Flexion. There are several movements: flexion, extension, adduction, abduction, circumduction. Okay, of this thumb. Okay, so this is a flexion, flexor muscle. Deflexion. There are some superficial flexure, one deep flexures. So flexor pollicis longus. Okay, and from the lower 1/4 of the anterior surface, we will get origin of another muscle. Sorry. In the lower 1/4 of the anterior surface, this is radius and this is ulna. We will get one muscle in the anterior surface of the lower 1/4 of the anterior surface. We will get attachment of one muscle. That muscle is taking origin from the lower end of the ulna. There is a ridge from where this muscle is taking origin, and it is inserted over the lower end of the radius. And this muscle is causing pronation. When this muscle contracts from here, there will be pronation. This is like this. So when this muscle is from here, it acts, there will be pronation. Okay, and it is a quadrangular shaped muscle. quadrangular shaped muscle. So name of the muscle should be pronator quadratus. Okay. So pronator quadratus is taking origin from the ulna, and from the lower 1/4 of the ulna there is a ridge, and it is inserted over the lower 1/4 of the anterior surface of the radius, and it is quadrangular shaped muscle, and it is causing pronation. Okay, radius will move like this, so this is called pronation. So it is called pronator quadratus muscle. And the superficial fibers will get inserted over this area, and deep fibers will get inserted over this triangular area in the lower end of the radius. In the lower end of the radius is a triangular area. So the deep muscle fibers will get attached to this area. Okay. Only the superficial muscles will get attached over the anterior surface, and the deep seated muscles, this muscle from here to here, it has got superficial fibers and deep fibers. Deep fibers are attached to this triangular area. Okay. This is pronator quadratus muscle, okay, which has got superficial fiber and deep fiber. The deep fibers are attached over the triangular area. Okay. The deep fiber, superficial fibers and deep fibers are attached here. Superficial fibers are attached. Origin is here, insertion is here. Okay. Superficial fiber will attach here, and deep fiber will attach here. Okay. So pronator quadratus. Actually, the superficial fibers are really causing the pronation. Okay. Actually, the superficial fibers of the pronator quadratus muscle, they are actually meant for pronation. Straight like superficial fibers, and the deep fibers are basically the binders. There are several binders. Like in upper part we have seen the annular ligament. There are also the capsular ligament. It is a joint. So joint is surrounded by the capsular ligament. One is annular ligament. There is another quadrate ligament at the neck of the radius, and also the interosseous membrane also binds these two bones. And in the lower end we will get the inferior radioulnar joint. Here we will get the capsular ligament capsule, and also this is the pronator deep fibers of the pronator quadratus, which is also helping to keep this bone united. So deep fibers are the binders. Anterior surface. Now about the lateral surface, we can get a rough area. देखो এখানে একটা rough area. Similarly, on the lateral surface, we are getting the rough area. দেখো এইটা দেখতে পেয়েছো? lateral surface এ দেখো একটা rough area আছে. দেখো এটা দেখো, হ্যাঁ তুমি দাড়ি পড়লে কেন গো? আছে না? On the lateral surface, the anterior surface, this is the lateral surface. দেখো এখানে দেখো একটা রাফ এরিয়া দেখতে পাচ্ছ? দেখো দেখতে পেয়েছো? রাফ মানে খড়খড়ে, বাংলায় বলে খড়খড়ে, মানে স্মুথ রাস্তা আর ভাঙাচোরাতে খড়খড় খড়খড় করছে, মানে সারাক্ষণ গাড়িতে শব্দ হচ্ছে, খড়খড়ে, দেখতে পেয়েছো? দেখছো একটা রাফ এরিয়া তো। আমার আরেকটা হাত হয়ে গেলে খুব ভালো হয়, এই বুঝেছো, বুঝতে পেরেছো? তাহলে এটা, হ্যাঁ হ্যাঁ, এই যে আমরা ফিল করতে পারবো, তোমার হাতে ফিল করবে, এই যে স্টাইলয়েড প্রসেস, বুঝেছো? স্টাইলয়েড প্রসেসটা এখানে ফিল করতে পারবে, বুঝতে পেরেছো? এইখানে ফিল করবে, দেখবে নিজেরাই পাবে। তো এটা হচ্ছে ল্যাটারাল সারফেসে একটা রাফ এরিয়া, এটা ল্যাটারাল সারফেস, রাফ এরিয়া। এই রাফ এরিয়া ল্যাটারাল সারফেসে, হ্যাঁ এইভাবে থাকে, দেখেছো ল্যাটারাল সারফেসে রাফ এরিয়া, এই যে this is the humerus, this is the radius, and this is the ulna. Okay. One muscle, this medial side and the lateral side. Already you know the medial, lower end of the medial side, lower end of the humerus. This is the one prominent medial epicondyle, and laterally not much prominent, but we can feel that is the lateral epicondyle. You know, madam or sir has already told you, this medial area is for origin of the superficial flexure muscle, medial side. Similarly, the lateral epicondyle is for origin of the extensor muscles. From here, it will go on the extensor aspect. So superficial flexures, and from here the superficial extensor origin. Okay. So superficial extensor is another one muscle, is among them there is one muscle which is called the pronator teres. Teres means a straight muscle. Okay. What? So this is taking origin from here, from medial epicondyle, and is inserted over the rough area on the lateral aspect. Okay. So it will cause flexion. Okay. And also when it will contract, it will cause pronation. It is origin is here, insertion is here. So when it will contract, there will be flexion, and also there will be a pronation. Pronation means like this. So this is pronator teres. Okay. So this rough area is for the pronator teres muscle. Okay. In dissection, we will see this brachioradialis on the lateral side and pronator teres on the medial side, and it will form a fossa here, which is called cubital fossa. Okay. So this cubital fossa we can find It is bounded laterally by this muscle. This is called brachioradialis, and this muscle medially. So pronator teres, taking origin from the medial epicondyle and is going down. So ultimately we can get a triangular depression in front of the elbow joint. This is called cubital fossa. So pronator teres is forming one limb of the cubital fossa. So pronator teres is taking origin from here and it is inserted over the lateral surface. So there will be pronation. Okay. Now about the posterior surface. Suppose this is the radius and this is the ulna. Okay. And this is the oblique line. This is the oblique line, posterior oblique line or posterior border. One muscle is taking origin from this area and also it is taking origin from this part of the ulna, and in between there is interosseous membrane. So this one muscle is taking origin from the radius, from the upper part of the posterior surface of the radius and also from the upper part of the posterior surface of the ulnar, same muscle. And this same muscle, and it is attached, it is going below, the tendons are going below. This muscle causes abduction of the thumb. Abduction of the thumb. Thumb is also called the pollex. This is flexion, flexion, extension, flexion, extension, flexion, extension. Okay. This is abduction away from the palm of from the plane of the palm. This is flexion, extension, flexion, extension. It is মানে parallel to the plane of the thumb, and this is at right angle to the plane of the thumb. This is abduction, and we can find the tendon also, that tendon of this muscle, that muscle which becomes tendon, and it is, we can see it here. Okay, that muscle is taking origin both from the ulna and from the radius, and it goes down. So name of the muscle should be abductor pollicis longus, APL, abductor pollicis longus. And also we can see another tendon here. এই যে দেখো যেরকম করছো, we can find another tendon. এটা abductor pollicis longus পেয়েছো, আর এটা কি? Another tendon which is called extensor pollicis longus. And here we are getting a depression. This area is called anatomical snuffbox. Abductor pollicis longus or extensor pollicis longus. Okay. Anatomical snuffbox. In the previous days, there was no gloves, nothing. So anatomists they had some addiction of sniffing. That's the snuff. Noshi, snuff. They used to place the snuffing material over here, and used to, during dissection, they were very much tired. So to rejuvenate themselves, they used to take the snuff. This is the anatomical where they used to place. নসি নাকে দিয়ে টানে, নেশা করে দাদুরা, দেখোনি দাদুরা নসি নেয় বার করে, নসি দেখোনি এরকম দাদু। আর ইউ বেঙ্গলি? স্নাফিং, স্নাফ, তাই না? So this is the anatomical snuff box, which is bounded laterally by the abductor pollicis longus, and within that there is another tendon, that is the extensor pollicis brevis. Along with abductor pollicis longus, there is another tendon which we can see during our dissection, that is extensor pollicis brevis, but this one is extensor pollicis longus. Okay, so this is abductor pollicis longus, and from here another muscle will take origin, and the tendon will move hand in hand with this muscle. So from the lower part of the radius, on its posterior surface, another muscle will take origin, and it will turn into a tendon, and these two tendons are remaining we cannot see, but during our dissection we can find the two tendons here. That muscle is called extensor pollicis brevis. Extensor pollicis brevis. So abductor pollicis longus and extensor pollicis brevis, they gives this impression. Then the extensor pollicis longus, it is taking origin from here, from the posterior part of the posterior surface of the ulna, and it goes like this. This is extensor pollicis longus, which ends in a tendon. Okay, this ends in a tendon, we can feel here. So abductor pollicis longus and extensor pollicis brevis gives this impression, and extensor pollicis longus gives this impression. Extensor pollicis longus is taking origin. বাবা এখানে দেখাই যাচ্ছে না গো, কি আঁকলাম, আর এটাও তো হেডেড, এই ছবি এঁকে তো কোনো লাভ নেই। হ্যাঁ দাঁড়া এটা তো কিছুই হয়নি, তাও এটা দিয়ে বুঝাই। তাও বোঝা যাচ্ছে, তাই তো? এটা বেশ। So extensor pollicis longus is taking origin, and there is another muscle which is called extensor indicis, which also causes extension of the index finger, which is called extensor indicis. That during dissection, each and every muscle will be absolutely crystal clear to you. Okay, so that is for the extension of the index finger. We can find this extensor indicis here. So these are the muscles which takes origin from the posterior surface of the radius and the ulna. So for radius, there is origin of the abductor pollicis longus and extensor pollicis brevis. And for ulna, this is the abductor pollicis longus, extensor pollicis longus and extensor indicis. Now come to the lower end. Forget everything. যদি মনে নাও থাকে পরে বুঝবে। In the lower end, we can find there are four surfaces. One is anterior surface, one is posterior surface, and posterior surface is very rough. Okay. And in the posterior surface, we can find one tubercle. এই দেখো এই tubercle-টা। ঠিক আছে, এখানে আলনাটা এইভাবে আছে posteriorly। এই দেখো tubercle. This tubercle in the posterior surface, so anterior surface, posterior surface, this is the medial surface, and this is the inferior surface. Now the posterior surface is very, we can get some the impression of some tubercles. দেখো posterior surface এ কতগুলো tubercle দেখো, একটা বড় সরো tubercle পাচ্ছ, এটা অনেকগুলো, there are groups, There are several grooves and tubercle. দেখো posterior surface তার মধ্যে one tubercle is very much prominent এইটা দেখো দেখো posterior surface we can find several grooves এখানে একটা group এখানে group এখানে group and very important tubercle here this is another tubercle again another group this most prominent tubercle means bony projection which is called dorsal tubercle of Lister এই যে টিউবারকেলটা হচ্ছে ডর্সাল মানে পেছনে আছে বলা ডর্সাল the posterior surface dorsal tubercle of Lister means one name of a person Lister এটা posteriorly দেখো দেখো এখানে একটা গ্রুপ আছে এখানে টিউবারকেল আবার গ্রুপ আবার টিউবারকেল এই যে মোস্ট প্রমিনেন্ট টিউবারকেল এর বলে dorsal tubercle of the Lister হ্যাঁ তার ঠিক মিডিয়ালি যায় এই যে ইমপ্রেশনটা যে ফ্লেক্সার পলিসিস লংগাস ওই যে যেটা রেখেছি এই যে একদম এইভাবে যায় এখান দিয়ে অ্যাবডাক্টর পলিসিস লংগাস আর এক্সটেন্সর পলিসিস ব্রেভিস যাচ্ছে আর এক্সটেন্সর পলিসিস লংগাস এখান থেকে অরিজিন করেছে করে এইখান দিয়ে যাচ্ছে এটাকে পুলির মতো ব্যবহার করে অরিজিন হচ্ছে যেখানে যে পয়েন্ট থেকে মানে মাসেলটা অ্যাক্ট করে জেনারেলি হ্যাঁ যেখানে ফিক্স থাকে এবং যেখান থেকে অ্যাক্ট করে ইনসারশন হচ্ছে অপোজিট সাইড ফ্রম ওয়্যার উই ক্যান গেট দ্য মানে অ্যাকশন ইউ ক্যান সি দ্য অ্যাকশন মানে এটা খুব রিলেটিভ এই যে বাইসেপস উপর থেকে অ্যাক্ট করছে তাই এটা একটা অরিজিন ইনসারশন আবার যদি এখান তলা থেকে করে তখন এটা কিন্তু অরিজিনের মতো ইট ক্যান অ্যাক্ট ফ্রম দ্য ইনসারশন অলসো সরি এদিকে এই দেখো এই পস্টিরিয়র পার্টে দেখো এতগুলো ইমপ্রেশনস এই গ্রুভ আছে এই আছে এখানে একটা বড় এই যে এটা টিউবারকেল এটা হল ডর্সাল টিউবারকেল অফ দ্য লিস্টার তার মিডিয়ালি দেখো একটা বড় একটা বেশ দেখো ইমপ্রেশন আছে গ্রুভ আছে দেখতে পাচ্ছ না বলে গুরু কুচকে দেখছো তো সেই জন্য মনে হচ্ছে দেখতে পাচ্ছ না দেখতে পেয়েছো এটাকে ডর্সাল টিউবারকেল অফ লিস্টার বলে এটি মিডিয়ালি দেখো এটা ভেরি ইম্পর্টেন্ট এটা যে এক্সটেন্সর পলিসিস লংগাসের ইমপ্রেশন এই এক্সটেন্সর পলিসিস লংগাসের ইমপ্রেশন এখান দিয়ে যায় এক্সটেন্সর পলিসিস লংগা ইপিএল এর টেন্ডনটা এখান দিয়ে যায় তাই ইমপ্রেশনটা ডর্সাল টিউবারকেল অফ লিস্টার দেখো এতগুলো ইমপ্রেশন এটা গ্রুপ টিউবারকেল আবার গ্রুপ আবার টিউবারকেল আবার গ্রুপ এখানেও গ্রুপ এটা হচ্ছে এটা এর সাথে লাগে এই গ্রুপটাতে এটাকে বলে ডর্সাল টিউবারকেল অফ লিস্টার মনে রাখো এটা ঠিক মিডিয়ালি একটা ইমপ্রেশন আছে This is the groove. This is the groove. This is the tubercle. Again groove. Again tubercle. Again groove. So lower end of the radius on its posterior, the anterior surface is smooth. Posterior surface, we can get several tubercles and grooves. ঠিক আছে? But you can understand Bengali. তাহলে আবার কি? তাহলে তুমি বাঙালি হয়ে গেছো। আবার তুমি আবার অবাঙালি হিসেবে নিজেকে বলতে চাইছো ছোট থেকে এখানে দেখেছো তো সো দিস ইজ দ্য ডর্সাল টিউবারকেল অফ দ্য লিস্টার ডর্সাল এই দেখো অনেকগুলো গ্রুপ আছে লোয়ার এন্ড অফ দ্য রেডিয়াস অন দ্য posterior surface is identified by these grooves tubercle grooves anterior surface is smooth and in the posterior surface is related to several muscle tendons is related to the muscle tendon From lateral side, we are getting some extensor muscle, extensor carpi radialis longus and brevis. Extensor carpi, carpal bones, extensor carpi radialis longus and brevis, they are placed here. More laterally, abductor pollicis longus and extensor pollicis brevis. Medial to the lister tubercle, we will get extensor pollicis longus. Then we will get extensor indicis. And in between radius and ulna, we will get the relation of extensor indicis. Extensor digiti minimi, extensor digiti minimi is passing just at the back of the inferior radioulnar joint, and there is an impression between this head of the ulna and the styloid process of the ulna. There is one groove. This is for extensor carpi ulnaris. Just remember, the lower end of the radius has got several tubercles and grooves, and they are related to several extensor muscles and abductor muscles. Okay, now on the medial side, we are getting an articular area for articulation with the head of the ulna. This is called the head of the ulna. So to form this joint, this is called inferior radioulnar joint. Any movable joint is called synovial joint. So synovial joint should be, there will be covering of capsular cartilage. One joint capsule will cover it. Okay. So this joint is definitely a synovial joint, and type is a pivot joint. Similarly, this joint is also a pivot joint. Okay, and these are joints where we can get the movement of supination and pronation. Okay, so this is superior radioulnar joint, this is inferior radioulnar joint, and in between we are getting the middle radioulnar joint, which is contributed by this interosseous membrane. It is called fibrous joint. Fibrous joint, fiber-like, interosseous membrane is fiber-like, so it is a fibrous joint. Okay, so lower end is for this. In the lower end of the radius, we will get the ulnar notch. This ulnar notch will join with the ulnar head. Okay. In the lower surface, we can get one triangular area laterally and quadrangular area medially. Okay. Triangular area laterally, quadrangular area medially. A triangular area is for articulation with a carpal bone, scaphoid, and this quadrangular area is articulation with lunate. Triangular area is for scaphoid and quadrangular area is for lunate. This is called scaphoid and this is a lunate, but it looks like a moon. So lunate. Okay. Scaphoid is a boat shaped bone. Okay. So this triangular area is for scaphoid and quadrangular area is for the lunate, and they forms this what joint? Wrist joint or radiocarpal joint, and wrist joint is only contributed by the radius, not the ulna. আমি এক্ষুনি বলবো, আচ্ছা কালকে বলবো ওটা, কারণ ওটা আলনার সাথে। So lower end of the radius you can find articular area is smooth, and lateral triangular area is for articulation with the scaphoid, and this quadrangular area for the lunate. There are several bones: scaphoid, lunate, scaphoid, lunate. Okay. Triquetral, pisiform, trapezium, trapezoid, capitate, hamate, হুক আছে, তো পরে জানবে এগুলো। তো অ্যাটলিস্ট জানো this triangular area is for scaphoid and this area is for lunate. So which will form radiocarpal joint or the wrist joint. Wrist joint is contributed only by the radius and the carpal bones. Lower end দেখো at a triangular area laterally. Lateral মানে এইটা, এইটা 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 এই যে ল্যাটারাল, এটাকে ঘোরালেও তো এটা ল্যাটারাল সাইডই থাকে, এটা ল্যাটারাল তো অ্যানাটমিক্যাল পজিশন। আমি এরকম ঘোরালেও থাম মানে ল্যাটারাল। তো অন দ্য ল্যাটারাল সাইড we are getting one triangular area, one quadrangular area medially. This is for scaphoid and this is for lunate. এই দেখো scaphoid, এটা scaphoid, তার জন্য triangular area, আর lunate হচ্ছে quadrangular area. দেখেছো তো, scaphoid and lunate. Okay, so this forms wrist joint. The batsman should have strong wrist joint. একটু করে ফ্লিক করে দেবে, এই এরকম করে ফ্লিক করে না, ব্যাট নিয়ে ফ্লিক বলো না, আস্তে করে এই রিস্ট জয়েন্টে তার কাজ বেশি। So wrist joint is contributed by the scaphoid and the lunate, scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. পরে জানবে। ক্লিয়ার? এই দেখো